We want to get to this study on mammograms, which is making a lot of news this morning, trying to straighten out all the conflicting advice that women have been getting about mammograms. The report was actually analyzing some studies, and it finds that having one mammogram every year leads to too many false positive results. So, being tested every other year is enough, it concludes.
Yeah, the researchers say that skipping a year between mammograms adds only a small increased risk of finding breast cancer at a later, harder to treat stage. Joining us now is medical correspondent Dr. Jennifer Ashton.
Good morning, guys.
Good morning to you. So this is not new data; it's a new analysis.
That's correct.
Of older data. What does it tell us?
Well, basically, the controversy about mammograms and how they should be used continues. And again, this is Breast Cancer Awareness Month, so you can question the timing of this latest analysis of data. This was a large compilation registry data over 200,000 women aged 40 to 59, followed between 1994 and 2006. The study found that women who had annual mammograms, so they had mammogram screening every year, had a higher, the rate of false positives. Over half of these women will have a false positive recall, which means that something was found on their mammogram that turned out not to be cancer, requiring them to come back. And 7 to 9% of these women would have a false positive biopsy. So the point of the researchers was to say, listen, if you're going to screen every year, be prepared for a high likelihood of these results.
Okay, so that's one part of it. There's also a lot of people are actually concerned too for other reasons about going for a mammogram every year.
Sure.
There's the false positive aspect, but also, I mean, are there actual risks that we should be concerned about if it's an annual event?
So important all the time. You guys have heard me say it repeatedly. Any test you get, you want to find out what are the risks, what are the benefits. Now, when you talk about mammogram screening, the benefits are obviously the potential to find an early stage cancer before it could be felt by the doctor or the patient. However, like any screening test, there are risks. And when you talk about a mammogram, you are talking about small risk of radiation exposure. That's a known. There is some discomfort. That's going to vary woman to woman. There is the cost factor. And again, the chance of a false positive, meaning something seen on that mammogram that turns out not to be cancer, but then generates other tests, fear, anxiety, pain, etc.
And so, by the way, there's digital and film mammography.
Right.
Same for both?
This study really found them to be about the same accuracy level. Most mammograms performed in this country today are the digital variety.
So bottom line then, what is the recommendation now for women, and does it apply across the board?
Well, it depends which organization is making that recommendation. Right now, some are saying start at 40, some are saying start at 50. Women need to talk about this with their doctors because it varies depending on their own individual risk factors. So these recommendations are not meant to take the place of a doctor's clinical judgment on that individual patient.
Jen, I want to ask you, this new study came out last night also about screening for cervical cancer. Right. What did we learn from that?
This is even more controversial in many ways, you guys. This was not about the Pap test per se. This was about the test looking for the human papillomavirus. We know that the majority of cervical cancer is caused by the sexually transmitted infection, HPV. This study said there is not enough evidence to recommend screening women over the age of 30 for HPV. I have to tell you, every year I attend national medical conferences, from the American College of Obstetricians and Gynecologists to the doctors who analyze cervical pathology. We have known for years there is a lot of evidence and data to support screening women over the age of 30 for HPV. So this is going to be just as controversial.
Okay, so as a board-certified OBGYN, you would say it's better to keep screening?
It's the standard of care right now in the American College of Obstetricians and Gynecologists.
Jen, thanks.
You bet.